Somebody told you that the cause of your buttocks pain is your SI joint, or maybe they told you it's sciatica. And depending on who you ask, you always get a different answer about the exact same pain. Here's what makes this one different from everything else in this series. The SI joint is the most overdiagnosed and at the same time under-recognized source of lower back pain there is. It gets blamed when it's innocent and it gets missed when it's guilty. So if you're trying to figure out whether your pain is coming from your SI joint or from your spine, let's try to separate them. And I'll be honest about why this is one of the hardest calls to make from the outside. I'll give you where SI joint pain tends to sit and how it behaves differently from a pinched nerve. And the one simple thing people with true SI joint pain almost always do when you ask them where it hurts. The last one is so consistent, it's almost a tell. I'll get to it. If you've watched other videos in this series, you know the rule I keep coming back to. Sciatica is not a diagnosis, it's a symptom describing pain along the sciatic nerve path. The job is always figuring out the source. And the SI joint is a sneaky source because it sits right where your spine meets your pelvis. It's close enough to the nerves that when it goes wrong, the pain can spill into the buttock and down the leg and feel like a pinched nerve. But mechanically, it's totally a different problem. This is a joint issue, not a nerve issue. As a spine surgeon, this is a distinction I have to get right before anyone talks about operating. Because doing spine surgery for what's actually an SI joint problem is exactly the kind of mistake that leaves people not better or sometimes worse than before surgery. So this one is personal for how careful we need to work to figure out what's causing the pain. Here's the one I promised, and it's the most useful clue I know for this. When I ask someone with SI joint pain where the pain is, they often do something specific. They put one finger right in that spot. On the dimple just off to one side where the spine meets the pelvis. SI joint pain tends to be localizable. One spot, one side, deep and aching. Pain from a pinched nerve is usually harder to pin down. It's more of a line or a band running down the leg because it's following the nerve, not sitting in a joint. So if you can cover your pain with one fingertip on one side of your low back, that's interesting and it leans towards the joint. But location is just clue one. The second clue, what does the pain feel like and how far it goes? This is where joint and nerve really separate. SI joint pain is usually deep, dull ache. It can spread into the buttock, the hip, sometimes the back of the thigh, but it usually doesn't march all the way down past the knee into the foot. And it usually doesn't come with that electric shooting pins and needle quality. That sharp electric pain below the knee with numbness or tingling, that's the fingerprint of an irritated nerve, which points back towards the spine. Now, does it break this rule? Of course. SI joint pain can refer further down the leg in some patients and fool everyone. So let me show you exactly how it fools people. When the SI joint refers pain, it tends to spread into a zone, the buttock, the back of the thigh, occasionally into the groin or the side of the hip. But notice, that's a patch or a region. It's not the clean line down the leg you get from a pinched nerve. A nerve follows its wiring. It gives you a narrow band that tracks past the knee, often into a specific part of the foot. The joint gives you a smudge. The nerve gives you a stripe. That's the difference your eye can actually hold on to. And it's why imaging alone never settles this. Which is exactly why we don't stop at 2 clues. The third clue, what provokes it? And as always in this series, I'm describing a pattern, not trying to give you a test to run on yourself. The SI joint is a load transferring joint between your upper body and your legs, so it tends to complain about asymmetry and transitions. Things people with SI joint pain often mention: pain climbing stairs, standing on one leg to put on pants, rolling over or turning in bed. And that moment of standing up from a chair or getting out of the car. Spinal nerve pain has its own provocations we covered in other videos. Bending, lifting, coughing. The point is that they tend to be set off by different things, and noticing which fits you is generally useful information to bring into your doctor. Now, why do I keep saying that SI joint is both overblamed and at the same time missed? Because there is no single slam dunk test for it. No one exam move, no one scan. We use clusters of provocation maneuvers in the office and they help, but no single one is the answer. And imaging is generally limited here. This is the rule I never break, and it matters more here than almost anywhere else. Imaging and symptoms have to be read together, never one without the other. An MRI can show an SI joint that looks worn in someone whose pain is actually coming from a disc or a nerve. And it can look unremarkable in someone whose SI joint is actually the whole problem. So how do we actually nail it down? Often the most telling step is a numbing injection placed precisely into the joint. If the pain quiets down when that specific joint is numbed, that's some of the best evidence we have that we found the right culprit. That's a diagnostic tool, not something you can sort out at home. But even that test is not perfect, and I'd rather you hear that from me. The numbing has to land in exactly the right place, and where the medication spreads can muddy the picture. That's why a single positive response is good evidence, and two, done carefully, is even better. I'm telling you this because a lot of people are handed one injection result as if it settles everything. It's strong, it's just not the last word. Here's why all this fuss over the label matters. If your pain is a worn, irritated SI joint and you get treated for a disc, even operated on for a disc or a nerve issue, you can come out of the other side just as sore because nobody addressed the actual source of the pain. And it runs the other way too. A real pinched nerve, dismissed as just your SI joint, is a problem left to get worse. The label isn't bureaucracy, it's the difference between aiming treatment at the right place and the wrong one. And here's a version of this that hits even closer to home for me as a surgeon. The SI joint sits right below the lumbar spine, so it's also affected by what we do to the spine above it. When segments of the low back are fused, the SI joints just below can end up carrying more load than they used to. For some people, that's when the SI joint starts to speak up, after a fusion, not before. It's one more reason I'm careful about when fusion is truly needed and when it is not. If you want the honest breakdown of that decision, I made a whole video on decompression versus fusion. I'll point you to that at the end. So, SI joint or spine? You now have real clues. Can you point to one spot? Does it stay above the knee? Does it flare with stairs and turning in bed rather than coughing and bending? Those clues are worth a lot, but they're still just clues. Because here's the thing this whole series has been circling. Every one of these conditions, the hip, the nerve root, the piriformis, the circulation in your legs, the SI joint, they overlap, they coexist, and they hide behind the same handful of symptoms. The clues help you ask sharper questions. They never let you or me, through a screen, close the case. And you've heard me land here every time, because it's the most honest thing I can tell you. A real answer is your history, your exam, and your imaging weighed together by someone trained to do it. And even then, what we reach is a differential diagnosis, which is our burst-supported explanation, ranked and held open to being wrong when your body says otherwise. That's not a weakness in the process, that is the process. If you find your way here without seeing the rest, the video that ties all of this together is my overview of what's actually causing leg and buttocks pain. Start there, and I'll point you to whichever of these fits you best. That's the whole map. Use it to walk into your next appointment as the most prepared person in the room. I'll see you there.